So we're starting off this week-long series that's called Cabinet Close-Up. And it looks at the president-elect's picks for his cabinet and, what they'll do for the country. And our first examination today, if you will be his choice for Health and Human Services Secretary, the Congressman Tom Price. Staunch critic of Obamacare now for a number of years. Galen Institute President GraceMarie joins us on, whether this is the type of person to put in place. Obviously, conservatives will tell you, no doubt about it, it is. And others may say he has trouble getting through the confirmation process. What's your thoughts on Congressman Price?
Oh, Connell, I think that you're really right to start your series with Dr. Price, because there could not be a better nominee for HHS Secretary. He is a top-tier candidate.
All right, tell us why.
He's a physician. He has vast experience as a state legislator, as a federal legislator. He was a committee chairman, and he really understands the need to reform our health sector. He has introduced his own legislation to reform health care, but in the way that puts doctors and patients back in charge of decisions, not government bureaucrats. Since the beginning of the Obamacare debate, he understands we need to fix this, but he also understands that there's a right way to do this, and we've learned now with Obamacare the wrong way.
To that point, it's easy to say you want to get rid of something, and that's where the repeal comes in. The replace part of repeal and replace, though, will be, you would think, more challenging, especially with the Congress. Even though the Republicans are in control of it, you still have a heavy Democratic voice, especially in the Senate, that may stand in the way of that replacement. Where are there areas, or what has Congressman Price or Dr. Price said that you've liked the most, something that could actually be done in terms of replacement?
Well, I think he understands the importance of having both a safety net and a bridge. You have to have a safety net for the 20 million people or so who currently are receiving some sort of coverage through Obamacare. It could be a lot better. And making sure they don't lose their coverage. But you have to, at the same time, build a bridge to a better system. And the 20 Democrats who are in states that Donald Trump won and are up for re-election in the Senate next year, I think are going to have a very strong incentive to look at ways to replace Obamacare in a way that gets back to the kinds of things the American people have said they want. Protecting the vulnerable, giving people true choices of the kind of coverage they want to buy rather than the coverage that the government says they must buy. Real competition that gives them many more choices than the cookie-cutter choices that Obamacare purported to
Okay, so
provide.
Choice will be important. And you're right. In the Journal, I think it was Jerry Saber wrote the article this morning that talks about those senators in these swing states, or these red states, really, like Manchin and Heitkamp and McCaskill, senators like that on the Democratic side that will have a lot of sway. So you get them on choice, okay, that's the one way to do it. And then what needs to stay in place? What do you give them that says, okay, we're working with you on this, and this is something that works that we're going to keep?
Well, the legislation that the Congress passed last year and that the President vetoed to repeal Obamacare included a 2-year transition so that people currently on Obamacare made sure that they could keep that coverage until they got new coverage.
Right.
But giving people the assurance that if they have a pre-existing condition, they can they can still get coverage, but they'll change the rules. They'll do it instead of with mandates, they'll do it with incentives, giving people the added incentive to purchase coverage because they can afford it. The problem with Obamacare is nobody's able to afford this coverage. You've got to get costs down, and you do that by returning a lot more power over regulating health insurance markets to the states, and that's what Dr. Price has been talking about for a long time. The congressional leadership has sent letters to governors saying, please send us your ideas. We want to partner with you to make sure that we return power to the states who actually know what they're doing in overseeing their health insurance markets, unlike the federal government, as we have learned, that actually has just so fouled things up.
What's a realistic timetable, or is there one, to expect this to get done, to actually be repealed, replaced, and for something new to be in place?
Well, that's the process part of this. We've got the policy, the product, the politics, and the process. And the process is actually something that is going to be dictated initially by Senate rules. And because the Senate can pass some forms of legislation through reconciliation, only needing 51 votes in the Senate. Republicans, of course, have 52 votes. They could pass repeal through the Senate, and it needs a simple majority in the House.
Right.
That could be done very quickly. Donald Trump has said, President-elect Trump has said that he wants to have a bill on his desk as soon as possible, repealing Obamacare. Replace is going to take longer, but I do think that they're going to work very hard to get at least some of those 10 Senate Democrats to come along,
right,
so it's truly bipartisan legislation.
And then that period of 2 years that you were talking about would be all the more important, especially as it's being worked through, if indeed we get to that point. GraceMarie Turner, thank you very much. We've really appreciated it, and we'll continue this series throughout the week as we talk about Congressman Price there.